Tonight, we're taking you inside the dispatch center so you can see and hear why nearly half of all calls every year are for unnecessary or ridiculous reasons. We didn't just track these unlicensed and unsafe vans, we also followed the money trail. And later, the district attorney found MedExpress was billing for several patients who died and a couple more patients in jail. Now there's finally a legal effort to make the owners and managers pay.
Some people view you and your agency as the enemy. What would you say to them?
What about the patients you put their lives at risk? Nothing at all, sir? This all started with a tip to 2 Investigates. We were sent these photos of a septic tank truck that's unloading its cargo and dumping it into a neighborhood manhole. Alarmed, the tipster asked us to investigate. We questioned one of the company's workers who were dumping there. That was before we found out this is all legal. We caught guards who were supposed to be monitoring campus on their cell phones, lounging around, talking to one another, and even this, where he took off his shoe and is massaging his feet. Now Merritt College in Oakland is on fire watch too because of failing alarms. Well, the real problem here is the city of Oakland relies on a system that will only inspect after it receives a complaint. And many renters say they're afraid to speak up for fear they'll be thrown out on the street. We uncovered a longtime landlord with a history of dilapidated and dangerous properties and a city department that fails to adequately follow up. Behind these walls are health hazards, mold and moisture, and in the walls, rats, often killed by the family dogs. For Melissa Rodriguez, it's life.
We put all the clothes inside of the bags so they won't get mold.
Many clothes are stored in plastic tubs, and food is protected from rodents in these bins.
I'm always worried about everything.
Especially after the roof collapsed and her youngest son was diagnosed with lead poisoning.
Everybody in this family is sick because of the house.
This nurse with Alameda County says paint or other hazards could have caused Alberto's blood level to spike. The family moved from another home owned by the same landlord with some of the same conditions.
He knows about all this problem.
And what does he say?
He's gonna come and fix it, but when? When?
2 Investigates found Chiku Fan owns this property along with dozens of others in Oakland. We went inside several of them, finding toilet issues and plumbing problems, kids sleeping next to mold from the ceiling to the floor, and crawling cockroaches, peeling paint, and electrical hazards. Records show code violations at his various properties dating back decades.
Rats. I'm talking rats as big as a cat.
This former renter sued Chiku Fan 20 years ago for unhealthy and uninhabitable conditions.
Never fixed anything. It was just a temporary fix.
Which is true even now.
This is the way that they're fixing.
Keeping rats out with metal mesh, replacing locks with this barn lock, and using loosely stacked bricks for stairs. Records show Oakland code enforcement issued violations, but as of last May, an inspector considered all the problems abated. How is that okay?
It's not. It needs to be investigated.
Larry Brooks runs the Healthy Homes Department for Alameda County. He says the city of Oakland doesn't have state-certified code enforcement officers and lacks a program to find issues before renters move in.
We really need to be more proactive in order to prevent those situations from occurring so that the burden isn't on the tenants.
Studies show low-income renters become trapped in the only housing they can afford. And without government coordination, problematic property owners slip through the cracks. Despite numerous attempts, the city of Oakland would not provide an on-camera interview, but describes its code enforcement as a tool to address violations that are a direct threat to life and safety. Still, we found many of those violations still exist.
It is frustrating that, we have code enforcement aware of the problems in this unit, aware that this landlord has for over a decade been a problem, but still we have these conditions existing.
Ann O'Mara represents tenants as executive director of the Eviction Defense Center. She was part of a task force that put Chiku Fan on a list of Oakland's worst rental owners. Why do you think this is allowed to continue?
That's the $1 million question, right? Why are we letting families and particularly children continue to live in these types of conditions.
Mr. Fan, Brooks Jarosz to Investigate.
Oh,
We decided to have a chat with Mr. Fan at his home,
I don't want to talk.
asking about the long list of issues.
These people, they always complain.
How do you know that your manager is doing his job? Have you been inside these places?
I did not check.
If he had checked, he would see the missing smoke detectors, the door that locks from the outside. If there was a fire, we'd be trapped. This is terrible. And wall outlets that don't even work. Maybe you should go back and look at all this
Yes,
stuff.
I will do that.
Still, Melissa Rodriguez and her family are fed up. They're suing, hoping for a safe and healthy home, knowing they're unable to afford anything else.
That lawsuit is just they try to make money.
I'm always sad. I'm thinking a lot that what I'm gonna do to change all what we are going through.
So you're saying you've done nothing wrong?
I will not say I've done nothing wrong. Sometimes if they complain, I go take care right away.
Now, that family pays $2,000 a month for rent. Two Investigates visited other East Oakland tenants who were afraid to speak up. The Eviction Defense Center says landlords will regularly retaliate and kick out complaining tenants. We also found incomplete or missing enforcement records or follow-up failures with the city of Oakland. Rental advocate groups say they've seen significant problems with the city requiring an overhaul of the entire system. That's what they think it's going to take.
She was just so beautiful. I mean, she always dressed, I always called her my model aunt. You know, she always looked like a model.
Daisy Mattis had just celebrated her 94th birthday, showered with gifts of love at the place she called home for years, the Gilroy Healthcare and Rehabilitation Center. But soon,
Then we started getting these horrible robocalls.
One resident tested positive for COVID-19.
the coronavirus got inside and exploded.
What do you think?
Oh my God, I was freaking out.
Debbie Timms and her sister, fearing for their aunt, started looking for a new nursing home and planned to move Daisy.
But there wasn't enough time. From the day that I got the positive test results, she died a week later.
Daisy is one of nearly a dozen who have passed away here.
My mother just passed away 30 minutes ago. Being in this facility was not good.
Other families visiting one last time just to collect their loved ones' belongings.
I think they should take responsibility for all this, for everything that's happening.
The nursing home is owned by Covenant Care. The company told us in early August it opened a COVID-19 recovery unit, an isolated wing with its own entrance, then started accepting COVID-positive patients from hospitals, 32 so far.
It's akin to having a match thrown into a vat of gasoline. You've got the most vulnerable.
Tammy Abreu Butron's mother will soon turn 87 and just recently contracted the virus at the nursing home, a place she's lived for a couple years.
I have such guilt, but I have no choice. And now she's in a situation where she has no choice.
She's one of 75 residents who were infected. The skilled nursing facility has just 132 beds.
Do the math. That's more than 50% of them have become infected.
But KTVU found this nursing home was cited and fined last month, all for failing to report COVID-19 outbreaks 3 separate times. Management says it was just a miscommunication that's been fixed.
No facility wants to reveal that information because it hurts business.
Mike Dark is an attorney with nonprofit California Advocates for Nursing Home Reform. He says most places aren't prepared, even with state guidelines.
The problem is very few facilities actually have the staffing, the PPE, and the good infection control records that allow them to do that safely. And so what we have instead of strong rules is a kind of Wild West.
In fact, the state excused the Gilroy facility from having to comply with minimal staffing requirements. And Covenant Care reports 54 healthcare workers have gotten sick with the virus, mostly after infected patients came from hospitals.
Why are we sending people who have COVID into nursing homes? It's insane.
In August, the California Hospital Association wrote this letter to the Department of Public Health, pushing for patients to be released and recover in nursing homes to free up bed space.
Hospitals have strong economic incentives to use those beds for things like elective surgeries, which can make them a lot more money. And so business interests are making a lot of the public health decisions, which we're seeing play out so disastrously all around us.
The state and Santa Clara County refused on-camera interviews, but documents show the California Department of Health urged skilled nursing facilities to prepare to receive COVID-19 patients.
I had no idea.
Genevieve Corbin says nursing home families were given no choice and got little communication. She's worried her husband, who's already ill, could soon contract the coronavirus.
Every single person that's in there has a human right, don't get me started on this, for their families to be told exactly what's going on, how their family's doing. I've got nothing of that, so I'm angry. I'm very angry.
And it's that pain that has brought these families together, sharing stories of then and now.
I still feel that sense of danger. I still feel that sense of urgency that somebody has to do something. There's people still there.
And for those families, the nightmare isn't over.
My biggest fear is that I'll lose her. I'm sorry. And I won't be able to hold her, tell her how much I love her, and to not be able to talk to her is so hard. I mean, I'm sorry.
Covenant Care turned down a repeated request for an interview, but did say all 23 hospital patients transferred here have since made a full recovery. It's backbreaking work, from oppressive heat to wildfires and smoke amid the COVID-19 pandemic. This is the reality of risks farm workers face in 2020.
The fall harvest is here and time is money. These migrant workers make $12 to $15 an hour. That doesn't account for travel time to and from the fields.
We drive 2 hours every single day to work here.
And out here, another thing that doesn't help, the scorching sun.
The heat, it's really hard for everyone to keep going.
But they do, no matter what the circumstances.
We have to keep going because where are we going to get money?
Raised in poverty in a family of farm workers is Assemblymember Robert Rivas. He now represents Monterey County.
They don't have a choice. They can't afford to miss a day's work.
We told him about children as young as 8 found working in the fields. And across the country, a federal report shows 500,000 workers are under age 18. Most are in California.
And I don't think you can make sense of that. I think it's heartbreaking, and it just shows that we've got to do more.
He's helped push and pass legislation to get farm workers relief, especially with risks mounting and wildfires growing.
It's hard for us to breathe. Even though if there was a smoke, we had to keep our mouth open so we could be able to breathe.
Most crops here have to be picked by hand, but protections are still limited, even amid the coronavirus pandemic. Farm workers side by side, day after day. Despite efforts to keep clean, data shows these essential workers are 3 to 4 times more likely to get sick with COVID-19.
We see it in young people as well, but we try our hardest to take care of each other by washing our hands, sanitizing everything, but that's all we can do for right now.
Because they can only work with what they're given, and investigations of produce operations are scarce, meaning lack of protective equipment, improper pay, or long hours in harsh conditions may go unchecked or unreported.
This is disgraceful. It must be changed.
Ann Lopez represents farm worker families. Her organization aims to stop unfair working conditions. She says thousands are undocumented and oftentimes don't have health care and don't get any government assistance.
No matter where farm workers turn, a door slams shut in their faces.
Lopez says farm workers are afraid to speak out for fear of losing their job, getting blacklisted as a troublemaker, or being deported.
People who picked that produce for you to eat tonight are living in slave-like conditions that are completely unacceptable by the American standards. Absolutely unacceptable.
I mean, I don't think it's a good place.
One field worker is raising her 2 kids here in substandard housing.
It only has 2 rooms. There's only a wall in between, and you do like the living room, kitchen, and the restrooms outside, showers outside.
All for $800 a month, and other farm working families live next door. The only luxury is walking across the road to work.
Where somehow it's all right to have them living in horrible, impoverished conditions, working till they die, living life expectancies of only 49 years. I mean, it's you know, it's just, this is unconscionable. This is no way to treat human beings.
For the younger generation, they have higher aspirations.
Do you want to work in the fields?
No.
Why not?
Because every time we have to go, we wake up early, and it's hot.
Some we spoke with are going to college, using field work to pay for school, all in hopes of prospering and having a brighter, safer, productive life ahead.
The governor just signed legislation to help farm workers. It provides COVID-19 related sick leave and directs Cal OSHA to track and report agricultural workplace investigations. I'm Jarosz, KTVU Fox 2 News.